Hi everybody, Dr. Daniel. Today I'll be talking about exercise and migraine and the beneficial effects of exercise on migraine. So first let me define and talk about aerobic exercise. That's the kind we're supposed to do. Aerobic exercise means you get your heart up to a certain level and keep it there for a period of time, like 20 to 30 minutes. And you need to be doing some kind of exercise to get you there. So such things as Jane Fonda aerobics, a rowing machine, elliptical, stair stepper, swimming, playing basketball, or things like that are really aerobic exercise. But aerobic exercise could maybe be fast walking, maybe, but it's really not playing tennis or racquetball because you stop in between, the time of intervals of serving and you just sit there, so you're not keeping your heart rate going continuously. Now the thing is, exercise is something one can do on one's own, and it can really help exercise and help you with sleep and things like that. So aerobic exercise is good for migraine. It also treats psychiatric conditions or just normal conditions all of us have a little bit of, and that's trouble sleeping. It can treat anxiety, panic disorder, depression. It can help with tension, type headache, and things like that. So, through the years, multiple articles have been written in the headache literature stating that exercise helps migraine, and it can decrease the intensity, the frequency, the duration of headaches if you do that. But some persons who exercise and work out will get what they call a workout headache. It usually comes if they're hot and they're exercising maybe in the sun, and just get sweaty and like that. So that can be treated medically, if you wish, by using just an over-the-counter medication like Excedrin or Tylenol or aspirin. Even if you're on a triptan, taking half of a triptan before you exercise and see if that'll help. You have to keep your limits of treatment only to 2 days a week. So if you overtreat, you'll get headache from that. Now, the other side of the coin there is that some persons who have a migraine, exercise will get rid of it, but in general, most people who have a migraine don't get better with exercise and want to kind of stay away from that. Exercise also helps things like sleep, anxiety, depression, panic disorder, and can be helpful for reducing tension type headache and insomnia. It's also helpful, and it's one of the lifestyle issues American Heart Association wants everybody to do for decreasing risk of atherosclerosis. So athero means fat, and sclerosis means hard. It means hard fat, or what's called hardening of the arteries. It's a medical condition, usually with aging. It's found with overweight, elevated cholesterol, obesity, things like diabetes, heart disease. And it makes the arteries become obliterated or obscured by cholesterol inside the wall of your artery. And so American Heart Association has recommended aerobic exercise for a person to decrease the risk of heart disease and stroke. If you're a physician filling out death certificates, the number one cause and the number one thing that's written on death certificates is atherosclerosis from heart disease or heart attack or stroke. And it's not something you want. Also, several years ago, a Mayo Clinic cardiologist stated that sitting was the new smoking. And the idea is most people got in the drift that smoking is bad for you and gives you lung and throat cancer, and most people try to stop it. The incidence of smoking is down in general. But sitting is now said to be the new smoking, and so exercise can replace that and help it. Next, I want to talk about some studies have been done using basketball players for NCAA from college basketball players and seeing the effect of exercise on that. I think basketball is one of the toughest aerobic exercises going, and the athletes who do that well, like pros, are really the most athletic and endowed persons in the world, like Michael Jordan or people like that. So the incidence of migraine in women is 25%, but in women who are in basketball players in college, incidence was 4.4%, much lower. And the incidence of migraine in men in general is about 6%, but in basketball players it was 0.9%. I'm not saying everybody should play basketball, but I am reporting that an intense aerobic exercise like that can really cut down the numbers of migraine. Also, they've studied levels of nitric acid in persons who were exercise groups, where they found that the exercise helped the migraine. They found it lowered their, increased their level of nitric acid. It should be increase the level of nitric acid production. Similar effects were found on endorphins, which are internally induced and produce kind of morphine-like painkillers, which can be increased by exercise as well. Now, not all of the literature shows that migraine is decreased with exercise. Some of the reviews that were done were critical of the type of studies that were done, feeling that they were not random-based and done like drug trials have been done with strict, rigid ways of doing the study. But much of the literature does show that. Some of the articles are written show, for instance, that exercise was as good as topiramate, which is a well-known migraine preventive drug, or as amitriptyline. So, all you migraine sufferers out there, get your jogging shoes on, get your water bottle, and let's hit the YMCA or the jogging trail. Good luck to all you folks. Please click like down there. Subscribe so I can follow you. And God bless all you people with migraine. I'll see you on the next talk.